Welcome to the deep dive. Today, we're zeroing in on a pretty significant hurdle for some of you,
hmm
specifically those who've graduated from non-accredited vet schools and are looking at certification in the US or Canada. We're talking about the BCSE.
That's right, the Basic and Clinical Sciences examination.
Exactly. And this isn't just, a quick rundown. We want this to be your guide, really, digging into common questions and the best ways to prep based on the info you've all shared.
Yeah, the goal is definitely clarity. Let's cut through some of the confusion surrounding it.
Okay, so first things first. To plan properly, you need to understand the exam itself. What does it actually look like?
Well, fundamentally, you're looking at a multiple choice exam, mostly.
Okay.
It lasts about 4 hours, give or take, and it covers a really broad spectrum. Basic sciences, clinical sciences,
Mm.
think anatomy, pathology, physio, pharm, microbio, all that core stuff.
4 hours is quite a stretch, covers a lot of ground. What about scoring? Is it one of those exams where you get penalized for wrong answers?
That's a really important point, actually. Yeah. No, there's no penalty for guessing.
Oh, okay. That's good to know.
Yeah, it definitely impacts how you approach it. Your score is purely based on how many you get right.
Mm,
So always take a guess if you're not sure.
right. Never leave one blank.
Exactly. The whole thing has 225 questions, but get this, 25 of those don't even count towards your score. They're pretest items,
Ah, so they're testing out new questions.
pretty much. So if you hit a question that feels, I don't know, really out there or super tricky, it might just be one of those. Don't let it throw you off too much.
Good tip. Okay, so no penalty for guessing.
Hmm.
Let's dive into the questions you probably have right now. Number one, what exactly is on this thing? What topics?
Okay, the core subjects are pretty much what you'd expect. Anatomy, biochemistry, histology,
The foundations.
right, microbiology, pathology, pharmacology, and physiology.
Yeah.
You really need a solid grip on all of these. Like pathology isn't just general principles, but specific diseases too.
So mastery across the board is key. You can't really skimp on one area.
Not really, no.
Huh?
Especially if maybe your original program didn't cover things quite the same way as accredited U.S. or Canadian schools. Identifying those potential gaps early on is super important.
Makes sense. Okay, next big question. How long do I need to study for this? What's the time frame look like?
The general advice, looking at the resources, seems to land somewhere between 8 and 12 weeks of dedicated study.
8 to 12 weeks. Okay.
But, and this is key, it's not just about clocking hours. You need a plan, a structured schedule that makes sure you hit all those subjects we just mentioned.
Like a roadmap, you said before.
Exactly, a roadmap. You need to map out time for each topic, like time for review, for practice questions. It's about systematic preparation.
And what might make someone need, say, 12 weeks instead of 8?
Well, it depends, right? How strong was your background in these areas to begin with?
Oh, right.
How familiar are you already with the kind of North American vet curriculum standard? Things like that.
Right. Individual factors. Okay, so we know what to study, roughly how long. Now, how do we study? What resources are actually helpful?
There's quite a bit out there, actually. You've got your classic textbooks, of course, still valuable for deep dives into topics.
Sure, the old reliables.
But then you also have a lot of online stuff, study guides, question banks,
Yeah.
things designed specifically for the BCSE.
We saw one mentioned quite a bit, Examsify. They seem to be making some big claims.
Yeah, Examsify comes up. They
Mhm.
position themselves as a top resource, mentioning over 400 practice questions, flashcards, simulated exams.
Sounds comprehensive.
It does. And what's potentially useful there is the active learning aspect. Lots of practice questions. They say they give detailed explanations.
Hmm.
That helps you find your weak spots.
And they have a study guide, too.
Yeah, a downloadable PDF guide, progress tracking,
Yeah.
different subscription levels depending on how long you need access, 30 days, 6 months.
Options are good. What else is out there online? Zuku Review.
Zuku Review is another one, yeah. They cover BCSE and also the Navally. They do that question of the day email thing.
Oh, yeah, I've seen those. Little daily practice bites.
Exactly. And interestingly, some chatter online suggests the BCSE might lean a bit more towards clinical application type questions, compared to maybe purely basic science exams.
Huh. That's worth keeping in mind when picking resources. More clinical focus.
It could be, yeah, something to consider.
Okay, those are paid options. What about if you're on a tighter budget? Any free stuff?
Definitely. Don't discount forums like the Student Doctor Network. People share a lot there.
Like study notes.
Sometimes, yeah, links to resources. There was mention of a Yahoo Naval Study Group. Apparently it has notes and source lists. At another site, Gumshoe Vet offers a free AZ cram guide based on the Merck manual.
So community resources can fill some gaps.
They absolutely can. Worth digging around those forums.
What about official practice stuff from the people who actually make the exam?
Good question. The CVMA website, Canadian Veterinary Medical Association, is key. They have actual BCSE practice tests available.
That seems essential. Get a real feel for it.
Totally. And they also have a tutorial for the Prometric testing system. That's the software you'll use on test day. Getting comfortable with the interface beforehand can, lower the stress level.
Smart. Any other official sources?
Well, the NBVME, they're the ones behind the BCSE and Navally they used to sell self-assessment tests. Might be worth checking if those are still around or if there's something similar now.
Okay, good lead. And if someone feels like they need more direct help, like one-on-one?
Tutoring is an option. We saw mentions of vet tutors, like someone named Sukmin on Superprof, who've actually passed the BCSE and Naval themselves.
Ah, so they've been through it.
Exactly. They offer tips, notes, online sessions. If you're really stuck on certain areas or just learn better that way, it's something to look into.
Wow, okay. So there's a ton of resources, from free forums to paid platforms to tutors. Let's try and boil this down. What are the absolute best strategies for passing this thing?
All right, strategy time. Number one, echoing what we said earlier, make a study plan, a structured one.
Not just study farm this week.
Right. Allocate time based on the exam outline, which we'll get to, but also based on your strengths and weaknesses. If you aced anatomy but struggled with biochem, adjust accordingly.
Personalize the plan. Got it. What's next?
Use the resources effectively. Don't just read passively.
Active learning, right?
Yes. Use those interactive quizzes, flashcards like on Examsify or Zuku. Test yourself constantly. Active recall is way better for memory than just rereading.
Okay, active engagement with the material. How important is just doing practice questions?
Hugely important. Consistent practice does a few things. It builds speed, improves accuracy, and gets you really familiar with how they ask questions on the BCSE.
Like dress rehearsals.
Exactly like dress rehearsals. You start seeing patterns, you identify tricky wording, you pinpoint where you need more review.
Makes total sense. Are there any sort of less obvious strategies that might help?
Well, some sources suggest maybe keeping a light eye on current developments, like glancing through journals. The exam is foundational, but context can help.
Okay. Interesting.
And don't underestimate study groups. Talking through tough concepts with peers can unlock understanding in ways studying alone sometimes can't. Different perspectives.
Bouncing ideas off each other. Yeah, I can see that. What about specific techniques while studying?
Definitely lean into active techniques. Summarize chapters in your own words. Don't just highlight.
Mnemonics, visual aids.
Absolutely. Whatever works for you to make complex stuff stick.
Right.
And this is crucial. Take breaks. Mindful relaxation. Burnout is real, especially over 8 or 12 weeks.
Pace yourself.
Yes. And after you study or do practice questions, take a minute. Reflect. What did you get right? What did you struggle with? Why? Then adjust your approach for next time.
Learn, practice, reflect, adjust. A cycle.
Precisely. It's a dynamic process.
You mentioned the exam outline earlier. How helpful is that for planning?
Very helpful. The CVMA provides a detailed BCSE content outline. It actually lists the main domains tested, like anatomy, pharmacology, physiology, toxicology together, pathology, medicine, anesthesia, surgery, diagnostics, animal welfare, preventive medicine.
Wow, okay.
And it gives you an idea of roughly how many questions are in each area, so you can weight your study time based on the exam's emphasis.
That sounds like a critical piece for efficient studying. Focus where the points are.
Pretty much. You want to align your effort with the test structure.
And the level of knowledge. Are we talking expert level or...
No, the benchmark is generally the knowledge expected of a new graduate from an accredited U.S. or Canadian vet school.
Okay, entry-level practitioner standard.
Exactly. The CVMA also has a BCSE reference list. Looking at the kinds of textbooks on that list gives you another feel for the expected depth and scope.
Good context. Okay, last thing on format. We said mostly multiple choice. What else might pop up?
Right, so while most are standard pick the best answer MCQs, you could also see other types. Things like matching questions.
Drag and drop.
Yep, drag and drop. Or maybe hotspot questions where you have to click on a specific part of an image, like an X-ray or a diagram.
Ah, okay. So being ready for different ways of answering is important too.
Yeah, if your practice resources include those formats, definitely use them so they don't surprise you on exam day.
This has been super helpful. A really thorough look at the BCSE, the common worries, the resources, the strategies. It's clear passing isn't easy. It takes real dedication and a smart approach.
It really does. But but it's a doable challenge with the right preparation. And remember, for many of you listening, the BCSE is that essential step towards the Noidigi, towards licensure. It's a big investment in your career.
Absolutely. So as you think about everything we've covered, the structure, the content, all these different ways to prepare, here's something to chew on. What's one specific study technique or maybe one resource we talked about that feels like it would fit your learning style best? What's one concrete step you can take, maybe even this week, to start building that study plan or exploring those resources? Think about that first step you can take towards tackling the BCSE.